Good morning, dear students. Today's topic is aortic stenosis. It is a congenital heart disease. This aortic stenosis, this condition is comes under the acyanotic conditions. Okay, here the acyanotic conditions is divided into two. Increased pulmonary blood flow and then obstructive lesions. No, okay. Here this condition is comes under the left to right shunt conditions. Okay, here we are discussing cyanotic conditions under that as aortic stenosis. What is aortic stenosis? It means you know about parts of the heart. No, here first we will see the parts, normal parts of the heart. These are the atriums. This is right atrium. This is left atrium. Below that, this is right ventricle, and below that, this is left ventricle. Here from the left ventricle aorta is there. Okay, here the aorta is passing from the left ventricle. Here one valve is there. That valve is called as bicuspid valve. Okay, here this valve is to closing whenever the ventricular contraction. This valve is open, and then the amount increased blood pressure is enter into the aorta. Okay, this is the normal way. But in this condition, aortic stenosis, what happened here? The aorta is having one valve, no? That valve is having stenosis. What is meaning of stenosis? Stenosis, it is an abnormal narrowing of a passage within the heart valve. That is in the aorta. Here the narrowing. Here, look at here, how much the gap is there in this aorta, the valve. Okay, so much gap is there, but here the abnormal narrowing, that is stenosis, is there in this aorta. Okay, this is about the aortic stenosis, means narrowing of the aortic valve. Okay, this is about aortic stenosis. Okay, coming to the introduction of aortic stenosis, it is a congenital aortic stenosis may be caused by a bicuspid aortic valve with fused commissure that does not open completely. What is commissure means? Here it is an abnormal stiffness is present in that bicuspid valve. I said no, valve is there, no, in the aorta. That valve is called as where the atriums and then ventricles is closing. In between that valve is there. That valve is called as bicuspid valve. Here this bicuspid valve is having fused, commused, means it is an abnormal stiffness, or even though some fusion of the stenosis, or narrowing of that abnormal narrowing of the part, that valve is there in that aorta. So here what happened? By a hypoplastic aortic valve annuals, or by the stenosis above or below the aortic valve, that it is comes under the types, that is subvalvular or supravalvular stenosis is there. Here the sub means below the aortic valve stenosis, and above means supra aortic valve stenosis is there, and then fibrous also is forming. Okay, this is about aortic stenosis. I will repeat again here why this aortic stenosis is present means, here the hypoplastic aortic valve annules or by stenosis above or below the aortic valve is there. What is here stenosis means? Here it is a narrowing is there. Okay, here the annulus means the stiffness is present the heart valves. Okay, where it means hypoplastic means mostly here the annulus, sometimes here the ring or stiffness is present in that valve or aortic valve. That means annulosis or stenosis is present below or above the aortic valve. Okay, and the results is turbulent blood flow, means turbulent blood flow means here the mixing or irrelevant blood flow, means here the mixing of the oxygenated and then deoxygenated blood flow across the aortic valve and into the ascending aorta. Okay, so that is present, and patient with the aortic stenosis must be evaluated for additional left heart lesions. That includes coarctation of the aorta, if any another congenital malformations is present or not, that is coarctation of the aorta, means narrowing of the aorta, that also is there. But here we are discussing about aortic stenosis, AS condition. Okay, it is also depending upon the another associated conditions, that is coarctation of the aorta. Okay, that also it should be ruled out. The mitral valve stenosis and then hypertrophic cardiomyopathy and hypoplastic left heart syndrome, that also may be ruled out, whether it is associated with the another congenital malformations of the left heart or aorta. Okay, this is about the aortic stenosis. Here again, aortic stenosis is the most common form of left ventricular outflow tract obstruction. Here the left ventricular outflow obstruction is there, and it is accounts for 3% to 6% of congenital heart defects. Okay, aortic stenosis may occur at any age, and it occurs more commonly in the boys than in the girls. In the most children, it is a progressive lesions that creates LVOTO. Means here the left ventricular outflow tract and velocity time integral. Okay, it is measured with the cardiac output. It is these are the lesions, means it is a progressive lesions that is created with the cardiac output, that is left ventricular outflow track velocity times also they are measuring. Okay, this is about the aortic stenosis. Overall the incidence rate mostly boys than the girls is there. Okay, here associated congenital malformations is related with this 3 to 6% of congenital defects is present. Once the child is having aortic stenosis, it is associated with the coarctation of the aorta, and then outflow of the aorta problems also is present with these conditions. Okay, and coming to the types of the aortic stenosis. What are the types of aortic stenosis? Here the total three types of aortic stenosis. First one is valvular stenosis, that is at the bicuspid level. The second one is subvalvular stenosis, at the fibrous ring is present at the subvalvular place. And third one is supravalvular stenosis, means above the valve the stenosis is there. Look at here in this image, this is the bicuspid valve. Here the bicuspid valve means that is valvular stenosis. Stenosis means the narrowing, the passage whenever the ventricular contraction, that is left ventricular contraction, here the pressure of the blood, the oxygenated blood may enter into the aorta, that is the normal way. When the pressure is there, the narrowing, the valve is having stenosis, means the narrowing is there at the level of the bicuspid valve. And then second type is subvalvular stenosis. Here the sub, below the valve, the bicuspid valve, below that the fibrous ring is formed. Because of that fibrous ring, the valve was not closing properly. Here this is the normal valve opening, here the narrowing of the valve. So because of some fibrous ring, the narrowing is there, unable to open properly, that is subvalvular. Supravalvular, third one is supravalvular stenosis. Here the above the bicuspid valve, that stenosis is there. Okay, that is present in this above the bicuspid valve. Total how many types of aortic stenosis? Total three types is there. First one is valvular stenosis, second one is subvalvular, third one is supravalvular. Valvular stenosis means at the level of the bicuspid valve, the stenosis is there, the narrowing is there. Subvalvular means below the bicuspid valve, the fibrous ring is forming. So that is unable to pumping the pressure. The blood is where it is where the left ventricular blood is unable to moving pumping to aorta. Okay, next third one is supravalvular stenosis, that is above the valve, that narrowing part is there. Whenever we are checking the ECG and then X-ray, the valve is good, the function of the valve is good, but the supravalvular stenosis is forming. So these are the three types of the aortic stenosis. Okay, coming to the pathophysiology and then etiology of this aortic stenosis, we will discuss as a flow chart. First, the blood flow at an increased velocity across the obstructive valve or stenotic area and into the aorta. Here the blood flow is increased because the valve is narrowing. So the pressure is increased. During the systole, that left ventricular pressure is raised dramatically to overcome any increased resistance at the aortic valve. What happened? Because here the narrowing is there. So through the narrowed part, unable to pass that oxygenated blood, where when the systole is there, where here the ventricle, that is left ventricular, the left ventricle is needs more pressure to pump the whatever the blood is dumped in the left ventricle, because the narrowing is there. Through that narrowing part, that blood is unable to move to the upper part of the or ascending part of the aorta. So here what happened, the myocardial ischemia may occur because of an imbalance between the increased oxygen requirement related to the hypertrophied left ventricle. Here the left ventricle leads hypertrophy. Here the left ventricle is having more pressure or hypertrophy also is there in the left ventricle, and the amount of oxygen that can be supplied also is needed. So here the left side of heart is failure, resulting in increased left ventricular and diastolic pressure that is reflected back to the left atrium and pulmonary venous. So again here the backflow is there. What happened here, the because of narrowing part of the aorta, here whatever the blood is present the oxygenated blood at the left ventricular, the pressure is more, the dumping is more, so it may enter into the left atrium and enter into the pulmonary artery. So the pressure is more in the aorta, artery, and then pulmonary artery, and then left atriums. Okay, this is the process is happening. Because of this, the left ventricular hypertrophy is there. Okay, the pressure is more in the left side of the heart, so it may lead to the left ventricular hypertrophy, the enlargement of the left ventricle is there. Okay, this is about the pathophysiology. All of you clear? Coming to the clinical manifestations of aortic stenosis, we will see the according to the age group. First, we will see the neonates. If child is having aortic stenosis at the age of neonates, means the severe congestive heart failure is there. That is the congestive heart failure symptoms, and then child is suffered with the congestive heart failure, and metabolic acidosis and tachypnea, faint peripheral pulse, poor perfusion, and then poor capillary refilling, and child is having cool extremities or cool skin is there. Poor feeding and feeding intolerance also is there. These are the clinical manifestations of child with that neonatal child with the aortic stenosis. Whether the child and then adolescent, what are the clinical features is there, means chest pain on exertion, and decreased exercise tolerance, dyspnea, fatigue, shortness of breathing, syncope. Here the child is having syncope. Syncope means sudden unconsciousness. Okay, here the child is because of decreased blood supply, means aorta is having narrowing, stenosis is there, the oxygenated blood was not moving properly. So what happened, a child is having syncopes, means sudden unconsciousness, because the decreased blood supply to the brain, child is having syncopes. Same as lightheadedness, means fainting, child is suffered with the lightheadedness, means same as fainting, sudden fainting is there. Whenever child is in lying down position, this sudden fainting or dizziness may be subside. Okay, next clinical feature is palpitations. Sudden death also is there because the oxygenated blood was not moving. No, the oxygenated blood was not supplied to the all organs of the body, so child is having sudden death. Okay, these are the clinical features of the aortic stenosis. Okay, coming to the diagnostic evaluation, first one is auscultation. Here the whenever we are auscultating the heart sounds, that is systolic ejection, that is murmurs hard at the best at the right upper sternal border, okay, and radiates to the neck. The murmurs we will easily identify. Now where that is right upper sternal border, okay, right side of the upper sternal border, okay, again it is radiates to the neck side, because the aorta is ascending, no, the narrowing part is there, so the murmurs also we will identify uh, above the chest region, that is the left side, it is moving upwards to the next side. And coming to the electrocardiogram, that is ECG, left ventricular hypertrophy, that is LVH, means because of overload is there in the left side of the ventricles and then left side of the heart, so left ventricular hypertrophy is there with the strain pattern may be seen in the severe cases, okay. These are the diagnostic evaluations. And chest x-ray, coming to the next diagnostic evaluation, that is chest x-ray, it relieves that increased cardiac still heart, means here the still heart means outline of the heart, it shows that whenever the marking of the heart, it may be hypertrophy is there, no, the outline of the borderline of the heart is having some deformity, means some deviation is then the normal is there, so a permanent aortic knob may be seen occasionally, forms post stenotic dilatation with the valvular aortic stenosis. Okay, these are the valvular damage and then valvular problems, and then still hold means bordering of the heart we will see in the x-rays. Next diagnostic evaluation is echocardiogram, two-dimensional echocardiogram with Doppler study and color 4 map also. It relieves that left ventricular hypertrophy and then increased pressure is there in the left ventricle because the aorta is having narrowing. So the blood circulation is decreased in the ascending aorta. Okay, these are the these we are identifying whenever we are checking the 2D echo. Okay, and coming to the management depending upon the type of the aortic stenosis. The types is there, no, aortic stenosis. What are the types? That is valvular stenosis and subvalvular stenosis and supravalvular stenosis. The management also is depending upon the, if it is valvular stenosis means the bicuspid valve stenosis is there, no, so the surgical management is aortic valvotomy. Okay, if it is second type, that is subvalvular stenosis, means here the fibrous ring is forming, no, so you are removing the fibrous ring. Okay, and then third one is supravalvular um, stenosis is there, so the valvotomy also is done for the third type of the this aortic stenosis. Valvotomy is needed for the supravalvular stenosis conditions. The total management of this aortic stenosis is balloon plasty. Through cardiac catheterization, they are inserting the balloon into the aorta and then they are dilating that balloon. Okay, like an catheterization. Okay, this is about the management of aortic stenosis. What is the management is? It is depending upon the type, and then the management is ballonoplasty. Okay, and look at here the balloon valvotomy. For whom we are doing this balloon valvotomy means children more than the age who are having high resistant pressure gradient, that is more than 64 mm of Hg across the aortic valve. Here the aortic valve, they are measuring the pressure. That is, if it is more than 64 mm of Hg, they are doing the balloon valvotomy. If the child is balloon dilatation in older children is safe, but in the neonates much more difficulty and then dangerous is there, that balloon dilatation. Sometimes balloon valvot, they are doing the balloon valvotomy. Otomy means to open. Okay, in some conditions they are doing the balloon dilatation itself only, they won't do the valvotomy. Otomy means they are opening. Okay, just they are dilating the balloon and then remove that balloon. So the whatever the fibrous and then whatever the narrowing is there, that is removed. Okay, this is about the surgical intervention of aortic stenosis. All of you clear? Balloon valvotomy and then balloon dilatation is there. Okay, balloon valvotomy, for whom they are doing means whose the pressure is above the 64 mm of Hg aortic pressure, that time only they are doing the balloon valvotomy. If the child is having neonates, and that time they are doing the balloon dilatation, but sometimes it is difficult and then dangerous, this procedure. Okay, this is about the surgical intervention of aortic stenosis, that is balloon valvotomy and then balloon dilatation. Okay, clear? And coming to the clinic complications. Okay, here the complications for all congenital heart disease, the complication is congestive heart failure and then pulmonary edema. Child is having pulmonary edema and then dizziness, lightheadedness. I said no, what is lightheadedness? Here the fainting means sudden fainting is there because decreased oxygenated blood to the brain. So child is having lightheadedness and syncopes. Here the sudden syncope means sudden unconsciousness is there because of decreased blood supply to the brain. Child is having unconsciousness and palpitations and arrhythmiasis. Here the arrhythmiasis means abnormal heart beating is there. We will identify in the ECGs. Child is having arrhythmiasis means abnormal heart beating, that is increased or low heartbeat also is there. Rapid or low heartbeats we will see in the arrhythmiasis conditions. And next one is infective endocarditis. Here the infective endocarditis means because of some infections, that mostly the bacterial infections, child is having some infective endocarditis. It is associated with the another problems, that is bacterial and then fungal infections. Mostly the bacterial infections is present in this congenital heart infections, congenital heart disease babies. Okay, that is an infective endocarditis and then sudden death, mostly because of decreased oxygen supply to the brain and then remaining parts of the body. What happened? Child is having sudden underwent the sudden death. These are the complications of aortic stenosis. All of you clear what is aortic stenosis? Aortic stenosis, it is a narrowing of the aorta. Okay, here mostly we will see in the three types of aortic stenosis is there, that is valvular stenosis, subvalvular stenosis, supravalvular stenosis. Valvular means bicuspid side and then subvalvular means the fibrous ring is present at the below the valve, bicuspid is there, and supravalvular means above the valve the fibrous ring is forming. Okay, the treatment is depending upon the type of the aortic stenosis, that is aortic valvotomy and then fibrous ring is removed and then valvotomy is there. The balloon valvotomy are they are doing and then balloon dilatation both they are doing. Means balloon dilatation is mostly they are doing whose child is neonates, balloon dilatation they are doing. Valvotomy means whose aortic pressure is more than the 64 mm of Hg, that time only they are doing the balloon valvotomy. Otomy means to open. Okay, this is about the complications. All of you clear about aortic stenosis? I hope everybody is understand.